Dr. Fong, you mentioned in another video where, missing teeth, sometimes or in most cases will lead to the teeth which are adjacent to the missing teeth kind of like start growing wrong, crooked, and displacing themselves and almost act like a crowbar on other teeth, which then it moves it around. And also, you said that people, because of it, start eating one-sided, and that affects the jaws here, which are very sensitive jaws. In fact, I've heard that those jaws are the most complicated hinges in the body. Is that true?
The jaw is a very complicated hinge in the body. Yes, it is. When teeth move or shift, they can cause a misalignment that leads to additional pressure on the bite of the individual. And when that happens, that can cause headaches, earaches, facial pain. It can even lead to loose teeth. And so taking care of the teeth alignment so that you are able to bite in harmony will help to preserve the jaw joint in the skull there.
Okay, so basically, whichever way, missing teeth is one thing, how the jaw can be misaligned. I'm sure there are other ways also, and maybe you want to, shade a little bit light on it. But whatever happens, once the jaw is misaligned, I guess you guys call it TMJ. Please don't make me pronouncing the real big name of it. It's just too complicated for me. But you might do that for our listeners. But now because of it, apparently severe headaches, neck pain, shoulder pain, even lower back pain could potentially evolve of it. And people might look in the wrong area to fix those things when it really is a matter of adjusting the jaw. Tell us about that. Number one, am I right there or am I mistaken there?
You're right. First of all, as you said, the TMJ is pronounced temporal mandibular joint. And also, as far as the teeth are concerned, that's probably the first place that needs to be looked at. Because if the jaw is not aligned properly, that leads to distortion or an unbalance in the jaw joint area there. And that is a direct result to maybe the teeth not properly meshing together. And so, as a dental professional, we may look in there to see if there are any worn areas or broken areas of the tooth there where there were previous interferences that led to that distortion in the jaw joint area there. Once we're able to identify those areas there, we can simply try to recontour the shape of the tooth to allow for the upper and the lower teeth there to meet properly without any interferences. When we can adjust for that and accomplish that, then the jaw joint is in much more balanced and harmonious alignment, and so then that can remove the previous headaches, migraines, neck aches, shoulder pain that result from that misalignment of interfering contacts between the upper and lower teeth.
Okay, so the treatment is not very invasive, really, in most cases.
When it comes to balancing the teeth, it's not. What we simply have to do is identify where those locations are, and then we just simply recontour the shape of the tooth. We're not grinding it away. We're simply recontouring the shape so that way the teeth fit together properly. Another form of treatment for that would be night guards, which we may recommend. And that simply is like a thin wafer of acrylic material that is custom fitted over your teeth there. So we take molds of your teeth, custom make it so that we will slip over the teeth there, and that helps to prevent one from clenching really hard against their opposing teeth, and that it also helps to relieve the jaw joint because of the fact that there's a soft interim material there that helps to absorb a lot of the pressures that occur from the teeth being grinding against one another or clenching against one another.
So if a person has had headaches, shoulder pain, neck pain, stiff neck kind of stuff for a while, and he has tried some things, chiropractors and, whatever it might be, and it helped but came back, kind of like, ongoing kind of situation. And if he hasn't yet looked at it from a capable dentist who does do TMJ, who looks at this whole thing, is that something it definitely a patient should go and include in his look? Because his headache might not come from his head. It might not come from his from other sources, but simply might come from right here from the jaws.
Yes, that's right. A person who's experiencing those symptoms should definitely involve a team of health professionals. That includes the physician, the chiropractor, and the dentist. And then together as a team, we might be able to help determine what the true cause of where those pains are emanating from.
Right. And of course, they might be emanating, the jaw might be slightly out of alignment because a guy had crooked feet, he needed orthotics or whatever, and then slowly it moved its way up and moved this, and so you might have to adjust the jaw, but at the same time the person might need inserts also. So basically a synergy is in case, or he might need an adjustment in his lower or upper back in order to straighten that out too, because otherwise one is getting the other one out of whack all the time. So there may be a triangle or even more corners are working together. Is that what you're saying?
That's what I'm saying, yes. I agree.
Well, all right. So basically, my God, this body is a synergy. I mean, it's just like everything is working together, which is good, I guess. I mean, that's why it is such a wonderful thing. But we tend to forget about it. We tend to... headache, and even some physicians, it's easy to go, headache, let's look at what's wrong with the head. Well, maybe nothing wrong with the head, at least not yet, but something wrong with somewhere else. The cause and the point of where you experience the pain may be very, very far-fetched apart. And it's good that medicine keeps finding these things out, that like, we were keeping looking here because it's hurting here, but it's really over here, nice and quiet, picking away. Dr. Fong, very interesting like always. Thank you very much.
Thank you.